Surgical treatment. Prior to the surgery, the colon is cleaned thoroughly to decrease the chances of infection. This is done using strong laxatives and enemas, or the patient drinks a gallon of a special cleansing solution the night before surgery to flush out the colon. This surgery is done with the patient asleep under general anesthesia. The operation can either be done through a big incision known as open colon surgery, or it can be done using special scopes and smaller incisions, a method which is called laparoscopic colon resection. In open surgery, the surgeon makes a standard incision in the abdomen through which the surgery is done. During a laparoscopic surgery, the surgeon inserts a miniature video camera or laparoscope into the abdomen through a small incision. The laparoscope allows the surgeon to view the inside of your abdomen on an outside video monitor. 2 other small incisions are then made to insert tiny instruments and operate. In some patients, laparoscopy is preferable to an open surgery because the incisions are smaller, recovery time is quicker, and less pain medication is required. But in some medical conditions, open surgery may be the only option. Sometimes the surgeon starts the operation using scopes, but may have to switch to an open operation if it is determined to be safer for the patient. An incision or incisions, if the procedure is laparoscopic, are made in the abdomen. The abdomen is then entered. The diseased part of the colon is taken out surgically, and the remaining colon is connected or anastomosed back together with flexible stitches called sutures. Here are some examples of a part of the colon being taken out and how the colon is then put back together. This is the case of the removal of the ascending colon. This is the case of disease involving the transverse colon. This is the case of disease involving the descending colon. When the disease involves the lower rectum or anus, another incision may be made near the rectum. When that part of the colon is taken out, there may be no colon left to attach to the other part of the colon. At that point, the colon is rerouted to the outside of the abdomen through yet another incision. This type of surgery is known as colostomy. Sometimes a colostomy is necessary if the surgeon thinks that the colon cannot be successfully reconnected with an anastomosis procedure. This may be the case if the colon is not believed clean enough at the time of surgery, or if there is an active infection that may threaten the anastomosis. If you have a colostomy, a bag is then placed over the opening of the colon to the outside to collect your stools. Bowel control is lost. If it is feasible, the colon could be put back together at a later date, usually 3 to 6 months later. Your surgeon will inform you of this possibility. In cases of colon cancer, the lymph nodes are then dissected to determine whether or not the cancer is spread beyond the colon. The rest of the organs in the abdomen are also very carefully examined. Suspicious lumps could also be taken from surrounding structures such as the liver, small intestines, kidneys, or uterus to determine if they are cancerous. Risks and complications. Colon surgery is very safe. There are, however, several possible risks and complications. Even though they are unlikely, you need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early.